this course, for example, is a course that's capped at 33 students because they end up working in teams of 3 to study 11 countries. The beginning of the class, what we do is choose the 11 countries. And they have to be from low, middle, and high income countries across the world, so it's comparative. But the US is the only one that we can't do, but we do all others. And we look at 4 core content areas: healthcare financing and organization, healthcare workforce, socioeconomic conditions of the country for health and healthcare, and then also we apply it to one disease area, treatment of HIV/AIDS. Okay, so I'm going to just first talk through very briefly about how what we do in the class fits this kind of model. So step 1, the first week, right, we're going to do healthcare financing and organization. They have a set of readings they have to do. They do those readings outside of the classroom. We come to the classroom, we talk about them. I might lecture some, we have discussion, and I'm going to show you in a few minutes the way we might do that. In this case, we use technology. We can do it with technology through an online setting. The best part of the class, the thing the students like the most, is step 2, which is when they work in their teams. Now, these teams are very highly structured. They have very specific content that they need to produce for each of those 4 areas. And so they work with their team to study their country, gather data for week 2, they're working on healthcare financing and organization, and then they present their work to the class. So they become very skilled in their one country case, and then they listen to and learn from the other students in the class for the other 10 countries. The teams are also structured in that they have the opportunity to evaluate one another. They have incentives to pay attention to the other teams who are presenting, because they're going to need to understand the material that comes from all of the different reports from their peers, and their peers actually evaluate them in their presentations on a variety of things, on the content, on the presentation, somewhat on their slides, were their slides too busy, those kind of things. So they're learning lots of different skills. When they get evaluated, they get back from me not only my evaluation of their country report on healthcare financing and organization and their presentation, they also get their evaluations from the class compared to what the class mean on the presentations are. So they're getting multiple forms of feedback among themselves and across the class. In a class like this, the faculty member, I feel like a manager almost more than a teacher, because what I have to do is structure the content. I need to help focus them. They can't just go out and find out anything they want about the health care system of Brazil. No, they need to find out how is it organized, how is it financed, what percentage of the system comes from government funds, from private insurance, do they have insurance, how is it organized, right? They have very specific questions. And I help the groups work together. I give them the tools to help them work as a team. They're not just left on their own. So they, at the end, get to evaluate each other. So if somebody, if Bob is just not pulling his weight, we get a chance to say that, because students really hate it when there's a slacker in the group who doesn't get identified. But they also, it's surprising, maybe not so surprising, how often they will also say, someone else in the group did a great job. They did more work than we did. They should get extra credit. So it's a way for them to really evaluate each other, and they know that that's in there as a safety valve if somebody isn't pulling their weight. And they, I think, really start to pay attention to things, their own behavior, hopefully, but they notice things that really worked well. I'm going to now try to use that myself. So it's a way to get them to pay attention and learn from each other as much as from the content that I deliver. Third step is that at the end of the week of presentations for each of the core areas, they have I used to call it a take-home quiz, but students really hate the word quiz. So now I call them papers, short papers, right? Where they now have to analyze and synthesize across all of these countries. And usually they have some question that requires them to go back to those facts and theories that we talked about at first, and then needs to present evidence from at least 4 of the countries that they heard about. They know their own in depth, and now they have to have paid attention to what their peers have taught them, and they need to then synthesize that for me to evaluate. And that's a tool, right, not just for them to synthesize their knowledge, but it's also a tool for me to know how well did they really get some of these points. Did they miss something? Do I need to go back and make sure that I cover something in particular? And now I want to give you a little flavor for what we actually do in the class and how we might use, for example, the technology that you have that might help in even that earliest stage in knowledge and comprehension. So for example, one of the weeks we're going to be talking about the global distribution of health and healthcare. So you're at a disadvantage. You did not do the first week's assigned reading, but I'm going to still ask you the question. So I can evaluate how well they've done the reading and even use this then as a tool for discussion by saying, low and middle income countries in the world comprise 84% of the world's population. What percent of the disease burden do low and middle income countries account for? So if you think about the burden of disease in the world as being 100%, what percent of the burden of disease is in low and middle income countries? If you think it's proportional, you might just think it's 84% because that's the 84% of the population. So you can choose your response on the clicker in front of you, and it's anonymous, so I don't know, so don't be afraid of making a mistake. I can then use, these are just on facts, it's just a way to try to get even into the reading, but then I can use it to say, okay, so now that we know those figures, we can talk about this slide, which compares high-income, middle-income, low-income countries. This is from the World Health Organization. And it compares their death by cause of death, 2004, projected 2015, projected 2030. Okay, so another way we can use this kind of technology and try to think about how we might convey that knowledge and comprehension step in the higher order thinking is, in the social sciences, we often talk about value-laden ideas and things that can be controversial. This one isn't all that controversial, but there's definitely disagreement. Is healthcare a human right? What do you think about that? Some people may feel uncomfortable saying, I'm not sure healthcare is a human right. Especially in a class on global health systems at Dartmouth College, where most of the people in the class are here to, go out and end suffering throughout the world, but that we want to have some of that conversation. How do we enable those difficult discussions, and how might we motivate that? We might want to talk about other controversial issues in all kinds of classes. So this is a way that students can share an opinion. Maybe they want to even do it just as a devil's advocate so that we have a conversation. And so tools like this technology also enable us to teach in a way. We've always talked about these issues in the social sciences and throughout Dartmouth, across fields, but this is a sort of a tool that helps us do it in a somewhat different way. I can tell you for this class, the thing the students remember most is step 2, really where they're working in teams and where they are coming up with, they're learning about their countries. So it is designing the class, thinking about the goals of the class, which is what we learned from resources at Dartmouth like DECAL, thinking about what are the goals of the class. Yes, they need to learn about global health systems in general, what are the features of healthcare systems and how do we fund them and how are they organized. We want to learn some things about developing middle income and high income countries and the variety of systems out there. And we want them to really be able to do some comparison, to evaluate and understand the big picture and the individual case. So that's an example. Not all social science departments or classes do, pedagogy this way. The curriculum is distributed across different types of classes, and certainly every department has classes that operate like this. But in the social sciences, and I think we are really have perfected this at Dartmouth, we can do cutting edge research. We can be the top scholars in our fields, in the social sciences, in the arts and humanities, without graduate students. That is not in any way a reflection on where the graduate students are. That's really important for not just the research, but that's an important part of the pedagogy in lots of departments. Having a graduate student in the lab is different from having a faculty member in the lab, and there's real value there. Even, we're used to kind of talking about it, that the graduate students are somehow not good for the undergrads. They are. And I mentioned to the last group, we had we're doing a search in sociology for an assistant professor right now, lowest level, and we just, I won't share the university this time, a major state university who sent an email and said, would you consider a tenured faculty in the pool, because I'd give anything to come to Dartmouth. This is a place where they've got graduate, that 10 years ago, that we didn't hear that, because you would say, why would you ever go to a place without graduate students? Well, now they can see the scholarship, the research productivity stacks up against the best universities. We can do our research without graduate students. The benefits of smallness are that you look outside of your department. So of course we are colleagues with economics and government and the other social sciences. Right. And I work with computer science. I work with the economists. I work with TDI, right? You are almost forced, that doesn't mean everyone should do that or everybody is multidisciplinary, but you are forced to find the connections. I work with Mark Williams over in film and television studies. You figure out, I actually have a lot more in common, or I have something in common with that group over there. Work with people at Tuck, right? When I'm surrounded by 5 other people who work in my same field, well, my gosh, I just walk down the hall and talk to them. Mm-hmm. And of course, I like my colleagues a lot, but the benefits of smallness are that it enables collaboration in a way that I don't think is possible at the big places. It's actually more difficult in those places.